This is your introduction to musculoskeletal assessment. We are going to be going over some of the key points of your musculoskeletal assessment as an introduction, and then we'll follow up with your chapter 24. But this is just to help you prepare and thinking about your assessment in your lab. So your musculoskeletal assessment includes bones, skeletal muscles, and joints. And we do several things when we're assessing your patient's musculoskeletal health. So we observe their gait and posture because it takes the strength of the skeletal muscles and the structure to hold somebody's posture, and also for them to have a symmetric gait. So we want to make sure that we're observing those things. That tells us a lot about your patient's status. We also inspect and palpate joints. We palpate those joints for any pain, tenderness, swelling. That's very important, and we're going to compare one side to the other to see if there's any difference. We're also looking for muscle strength. Again, you're always comparing those both extremities at the same time. And we're also looking for any either limb length or symmetry. So when we're looking at the bone structures, and I have a picture of a skeleton here, so we can start refreshing on what these bones, the names of the bones, how we are looking at them. You can see with the skeleton, he's in the anatomic man position. So when you're thinking about lateral versus medial, we'll start talking more about that as we are having to locate structures that we're assessing. So having these bones be symmetric, the skeleton is a puzzle that everything is put together. So when things are out of place, sometimes that affects the range of motion. So we look a lot at alignment. You might expect if somebody has a hip fracture, they have a malalignment, that the symmetry and maybe that bone might be longer than the other side because it's not where it needs to be in the hip joint. So looking at these things symmetrically is very important. And as well, when we start talking about chapter 24, we'll note that if your clavicles are asymmetric, or they're at a different height, or your hips are at a different height, that might identify some lateral malalignment like scoliosis, etc. So when we look at the joints, we inspect and palpate the joints. So you have joints in the cervical, thoracic, lumbar spine, your shoulders, arms, and elbows, all those places that bend and have that range of motion. So we want to inspect those joints for comparing the extremities for any asymmetry that we might need to identify, and we palpate them for warmth, tenderness, etc., like we talked about. So I listed the joints that we're going to focus on this semester. So here's some pictures of some of the range of motion. For example, for the spine, you have flexion, extension, hyperextension, lateral bending, rotation. Now you can see from these pictures the actual joints that they are focused on in some of these pictures is the cervical spine and the lumbar. Structurally, you can imagine that the thoracic doesn't have all the range of motion that the upper cervical spine and the lumbar does. So when you're talking about these, be thinking about what joint is actually providing the movement when you're assessing range of motion. So for the upper extremities, there's all different types of range of motion that we assess. So we're assessing the shoulder, the elbow, the wrist, the fingers, lots of directions. So be thinking about what the names of these tests are. Flexion, extension, hyperextension of the shoulder and elbow and wrist. Adduction and abduction is with the shoulder. Internal and external rotation, again, is with the shoulder. The supination and pronation, that is the wrist, and radial and ulnar deviation, as you can imagine, is the wrist, right? You have your radial side of your wrist and the ulnar side. The lower extremities, we will focus on the flexion and extension of the hips, knees, and ankles. So you have these pictures that kind of show you some of these movements. So the important part is not uh, um, knowing the exact degrees as much as it is when you are assessing a joint, what position are you, how are you doing that? So you'll see in the picture where it's an external rotation that the patient's knee is bent, but you're actually assessing the hip because the hip is rotated outwards. And if you can think there, when we are assessing babies, we do what's called an Ortolani maneuver, where we assess for hip dysplasia, and we take the baby's hips in a range of motion to make sure they're not popping or clicking, or that they're secure in place. But we do that with the baby's knees bent. So be thinking about that as we are practicing, we're doing some of these things, how you are assessing these joints and what joint you are working on. So we will also assess muscle strength. Um, for example, if you are providing resistance against movement. So we want to compare extremities. Maybe somebody's had a fracture, their arm was in a cast or something. We take the cast out and we try to assess their strength on that side compared to the non-affected side. We might expect the muscle strength will be different, but we will assess and continue to work on that as they heal. But we always compare them at the same time so you can identify any differences. So if somebody has full muscle strength, they were a 5 out of 5. So I'm providing a link to the Weber and Kelly Watch and Learn video for musculoskeletal assessment. You have to be logged into the point, but this is in your course content, and it's a way for you to review this material prior to going to lab, and so that might be helpful for you. Hope this was great information, and have a good day.